Runner's knee, perhaps you better get to the simple basics first of all. What is it? And
well, I mean, there are lots of lower extremity injuries, and I've picked the runner's knee because essentially that accounts for about 30% of lower extremity injuries.
In sports people or in all your patient population? You think?
I think we've got a slide talking about the incidence rate actually. But
which will be in the handout that we'll send out after the show. Yeah.
So it's about 18% in the runner in retro-patella pain, and ilio-tibial band's about 12%. But in the general population, patellofemoral pain can be anything in the order of about 12 to 14, 15%. Mm-hmm. So you do have people with retro-patella pain who are not actually runners, not necessarily doing sports.
Okay. So then the definition of runner's knee is what?
Well, if you look up the definition of runner's knee, the two things they focus on is ilio-tibial band syndrome and retro-patella pain. Mm-hmm. That's given the sort of title runner's knee, those two syndromes.
Right.
And there's a lot of overlap between those two syndromes as well.
Right, so retro-patella pain, but not patellofemoral ligament?
No, but a retro-patella pain is actually the cartilaginous surface underneath the patella. Yeah. There was thinking in the early days that a lot of it was due to patella tracking, that the VMO, vastus medius, oblique muscle was weak, and the tracking was the problem. We now know from functional MRIs and research that actually it's not the patella tracking, it's more to do with the femur over-rotating. Right. Because of a lack of control further up the kinetic chain.
Yeah. So the whole business of building up VMO in order to correct patella tracking is misplaced then, potentially?
Well, not misplaced in the sense that you would probably do that in addition, but if you think about the muscle mass you've got, if you look at the trunk and the pelvis, that's 2/3 of your muscle mass. There are much bigger muscle groups up there. They're going to have more influence on your biomechanics than a very small muscle. Not to say that muscle isn't important, because it's very much involved in patella control. Yeah. So you would do that as well as the other muscle groups.
Yeah.